Well, it's very difficult to compare apples and oranges. If you're going to ask me about comparison between a botulinum toxin and surgery, well, both are two totally different things. Botulinum toxin is for dynamic lines or wrinkles. When we animate, what lines we get is due to the action of the underlying muscle, and botulinum toxin softens these lines by making the muscle less strong. The action becomes less strong, and therefore you don't form these creases or dynamic lines. A facelift is a static procedure. When our face is still, whatever sagging we see, that can be rectified by lifting the facial tissues, and this is called as a facelift. A facelift surgery is done under anesthesia, so it includes taking either sedation or general anesthesia. There will be an incision which is required to reach the deeper layers of the face, and then there are stitches applied to lift the sagging facial tissues. Facelift is done for those individuals who need tightening of the facial structures or something which will reverse the sagging of the face. Botulinum toxin, on the other hand, is for the skin, which is developing dynamic lines. The effect of botulinum toxin will remain only for 6 months or so, and the effect of a properly done facelift should remain for around 8 to 10 years. So I would not say that both the treatments are contradictory to each other. On the other hand, both these treatments are complementary. Even after a facelift surgery, you may need botulinum toxin treatments to get rid of the dynamic lines, because facelift is only going to tighten your face. It is not going to make the muscles inactive. What makes the muscles weak or inactive is injection of botulinum toxin. So doing both the treatments is something which I would recommend. Both are not contradictory.